Hello there, I'm Mabel Jong and you're watching the World Healthcare Congress Interview Zone, and I'm so pleased to have with me Dr. Peter Angood, who is CEO of the American College of Physician Executives. Dr. Angood, thank you so much for your time today.
Well, thank you for letting me be here.
Well, we certainly are hearing a lot about physicians coming to the table, taking a more active leadership role in the changes that we're seeing on the healthcare landscape. Are physicians ready to do that? Do you see more and more coming and interested?
Absolutely. You know, there's some significant shifts going on in healthcare. The physicians themselves are wanting to be part of helping create not only change for their careers, their organization, but on a broader base as well. With some of the reform that's going on within healthcare, there's a variety of clinical delivery shifts that are happening, some financial model shifts. And so healthcare systems of all sorts and types are looking to have more in the way of engaged, integrated physician leaders. There's information and data out there that when you have well-integrated physician leaders who are helping drive an organization forward, the outcomes in terms of quality, safety, efficiency are better.
Makes sense, tremendous sense. And certainly there's no doubt that someone who has gone through the training to become a doctor has the dedication and certainly the intelligence to make a real, to make waves or to give a voice to the conversation. Do you find that most doctors have the leadership qualities to do this?
Most, not all, but you know, that's the nature of human beings. The physician population as a whole are very idealistic, quite altruistic. They're highly intelligent, strongly motivated, and they have a lot of the drive in which they want to create change. And so those are all characteristics of a natural leader. Where we still fail the physician population is through our formal education tracks. We're not quite giving them enough exposure in terms of formal leadership education, formal management training. And what we see on our side as you provide those physicians with that type of training, they are just excellent within leading organizations of all types.
So you're saying that the structure hasn't really provided the opportunity for more physicians to come and take a managerial and leadership role?
Correct, not in the formal education tracks. There is discussion and some initiatives beginning in those tracks within the medical schools as well as within some of the residency training programs. But by and large, the docs don't get that exposure just yet. On the other side of it, however, as we interact with a large number of medical students and residents and those docs in their early career stages, they all see it. They know that they want to have leadership training. They know that they want to have some management training. And so they're really just hankering for it.
We have heard also that many docs have been frustrated. Can you outline to me some of the frustrations that come with being a doctor today, and how can that be improved in the years ahead?
Well, there are a lot of frustrations. I think the increasing rules, regulations, standards, bureaucracy, the reporting requirements are all creating an increased load of documentation. The compensation levels continue to decrease a little bit, and the pressures to increase productivity have a lot of docs feeling like they're really working harder but not getting any further ahead, either in terms of their own professional satisfaction with patient care or with their own lifestyle. So we're seeing a big shift in physicians wanting to become employed for in a variety of different settings. And why do they want to do that? They want to lose some of the bureaucracy. They want more stable sets of income. They want a better work-life balance. They want to be able to get more engaged with creating some of the change in these systems and have enough administrative time in their days and their weeks in order to be able to contribute and not be feeling overworked all of the time.
So do you see that coming with the changes?
It's not coming, it's happening.
Okay.
It's happening.
Okay. Can we talk a little bit about some of the trends in the education of doctors and what kind of shortages we might see in some areas and the popularity of other specialties?
Well, when you talk about workforce shortages, it's in a couple of different ways. We continue to fully recognize that the primary care areas, family practice, the number of docs going into that is still relatively low compared to what the needs are out there. The preference to go into specialties is still somewhat there, although that shift is beginning to occur. But the other issue that's out there is the maldistribution of physicians once they finish their training. You know, their preference is still to work in urban and suburban areas and not be out in the rural or the smaller communities. And so that combination of the actual number of people who are graduating, not having enough of them, not going into the primary care, and not going into those underserved communities, it still creates the overall reality that we have a workforce shortage as it relates to physicians.
You have the opportunity at the American College of Physician Executives to really talk to a lot of different kinds of doctors. Tell me a little bit more about the Academy.
Sure.
Oh.
The American College of Physician Executives is almost 40 years old now, and it, in this day and age, really focuses in on trying to provide some leadership education and management training for all types of physicians, not just those who go into formal titled types of roles. Society certainly expects it, and we believe in it, that at all levels, all physicians are leaders at some level, is what I was trying to say. And if you think about it, that's true. So what we're really trying to help provide is for the physician workforce to really provide more in the way of organized leadership in whatever type of practice setting. And we're doing that by providing a variety of programs from student days all the way through to retirement, and really, you know, being able to help the physicians get more comfortable in their professional settings. Not everyone who takes our stuff has to become a member. We've probably trained well over 100,000 physicians. We currently have well over 11,000 active members, and we've got members in 45 different countries.
Terrific. And your message at the Congress this year, Dr. Angood?
Yeah, my primary message has been, you know, that healthcare gets better when you have well-educated, integrated physicians who are in leadership roles. The data is showing it. Patients are doing better. When you've got well-balanced, well-educated leadership physicians, everybody benefits.
Okay, Dr. Angood, thank you so much for your time today.
Oh,
A pleasure to see you.
Appreciate it.
And I'm Mabel Jong. Thanks for watching.